Imagine a patient screaming, throwing objects, or even threatening staff. One wrong move, and the situation can spiral out of control. I'm a psychiatric nurse, and today I'll show you exactly how to approach aggressive patients safely, de-escalate tension, and protect both yourself and the patient. By the end of this video, you will know the 8-step method that professional nurses use every day to handle aggression in psychiatric settings. Aggressive behavior in psychiatry isn't always what it looks like. It's often a sign of something deeper: fear, frustration, or overwhelming confusion. The way you respond in that critical moment can either diffuse the situation or make it much, much worse. This is precisely why nurses are trained in specific, structured communication and safety strategies. It's not just about what you say, but also how you say it and how you stand, you know? Your vibe really matters. And how you create an environment of safety even in the middle of chaos. Knowing these skills is fundamental to our practice because it allows us to help the patient through their distress without anyone getting hurt. So let's get into the first and most important step: ensure safety first. Before you even think about opening your mouth, you need to quickly assess your surroundings. Where are the exits? Is there a clear path to get out if you need to? Are there any objects nearby that could be used as a weapon, like a chair, a tray, or even a heavy book? If so, you need to create space or have them removed. Always maintain a safe distance, at least an arm's length away, but preferably more, and never, ever face severe aggression alone. If the situation feels threatening, hit your personal alarm or call for backup immediately. Your safety comes first. Remember, you can't help anyone if you get hurt in the process. Once you've secured the environment, we move to step 2, a calm and non-threatening approach. Your body language and tone of voice speak volumes before you even say a word. You want to speak slowly in a low, calm tone. High-pitched, fast talking can be perceived as anxiety or aggression. Keep your body language open, uncross your arms, and keep your hands visible, preferably open and relaxed at your sides. Avoid any sudden movements, pointing, or gestures that could be seen as threatening. Your eye contact should feel natural and caring, not like you're staring them down in a challenge. The entire goal here is to project calm confidence. You are the anchor in this storm, not another source of fear or anger. Now it's time to actually engage. Step 3 is to introduce yourself and acknowledge their feelings. This is how you start building a bridge. You can say something simple like, "Hi, my name is Alex. I'm one of the nurses here. I can see you're really upset right now, and I want to understand what's going on so I can help. Notice I'm not judging their behavior. I'm validating their emotion." You can say, "I understand this must be incredibly frustrating for you," or, "It sounds like you're feeling really scared." This isn't about agreeing with the aggression. It's about showing the person you see their distress. This simple act of validation can immediately reduce tension and start building rapport. It tells them you're an ally, not an adversary. With that connection established, we move to step 4, setting boundaries respectfully. This is crucial. You need to be clear about what is not acceptable. You can say something like, "I really want to help you, but for us to talk, I need to know that everyone will be safe." That means no yelling or throwing things. The key is to be firm but still empathetic. You're not delivering an ultimatum or getting into a power struggle. Never argue, threaten, or say things like, "You need to calm down right now." That will only escalate things. Instead, you're calmly and respectfully stating the rules of the interaction. These boundaries provide a sense of structure and safety for the patient, which can help them regain control over their impulses. Okay, let's talk about step 5, using practical de-escalation techniques. These are the tools you use to actively guide the conversation toward a calmer state. One of the most powerful techniques is offering choices. This gives the patient a sense of control and dignity. Instead of demanding, "Sit down," you could ask, "Would you like to sit here in this chair, or would you prefer to sit over there by the window?" Another great technique is redirection. If they're fixated on something that's agitating them, you can try to shift their focus. "I know you're upset about the phone call, but before we talk about that, could you tell me if you've had anything to drink today? I want to get you a glass of water." And of course, active listening. Let them speak without interrupting. Let them vent. Sometimes just being heard is enough to diffuse the entire situation. Throughout this entire process, you must follow step 6. Maintain a professional and neutral demeanor. This can be the hardest part, especially if the patient is saying hurtful things or being personally insulting. Your voice has to stay neutral and even. You must avoid reacting emotionally. whether it's with anger, fear, or frustration. If you get defensive, you lose control of the situation. Keep your communication simple, short, and clear. A distressed brain can't process complex sentences. Even if the patient is screaming at the top of their lungs, your calm presence is a powerful signal that the situation is under control and that they are in a safe place. You are the thermostat, not the thermometer. You set the temperature in the room. But what if none of this works? That brings us to step 7. Know when to escalate to a higher level of intervention. De-escalation doesn't always succeed, and you need to be prepared for that. If the patient's aggression is increasing despite your best efforts, if they start making direct threats, or if they move towards you in a threatening way, it is time to call for help immediately. Every hospital has protocols for this, often involving a trained response team. Never try to physically restrain a patient by yourself. Team intervention is always safer for both you and the patient. Your primary responsibility at this point is to keep everyone safe until the team arrives, and that means prioritizing a coordinated, team-based approach over solo heroics. And finally, after the incident is over, whether it resolved peacefully or required intervention, we come to step 8. Document everything. This is not just paperwork. It's a critical part of patient care and professional safety. You need to record what triggered the behavior, what actions you took to de-escalate, and how the patient responded to each intervention. Precise documentation ensures continuity of care, so the next nurse knows what worked and what didn't. It also protects you and your colleagues from a legal standpoint. Most importantly, it helps the entire care team identify patterns in the patient's behavior, which can help us prevent future aggressive episodes before they even start. So let's wrap this up with the final takeaway. Aggressive behavior is almost never just aggression for its own sake. It's often a cry for help or a sign of deep, unmet needs. As a nurse, your most powerful tools aren't found in a medical kit. They are a calm presence, clear boundaries, the skill of active listening, and a structured plan for when to escalate. When you use these tools together, you can de-escalate aggression safely, professionally, and compassionately. You can turn a moment of crisis into an opportunity for connection and healing. If you're a nursing student, a new nurse, a caregiver, or anyone working in healthcare, please share this video. The more people who understand these techniques, the safer our patients and our staff will be. Thank you so much for watching. Subscribe for more real-world nursing strategies that you won't always learn in a textbook. See you in the next video.